So today I am going to discuss antibiotic group tetracyclines. So first we have to go through the name tetra. Tetra means four. So the antibiotics that belongs to this group, they all have four ring and they form a cycle. Therefore they are called tetracyclines. The T also stand for, or you have to easily recall that T for 30. So this group of antibiotics or all the antibiotics belongs to this group acting on the 30S ribosome of the bacteria, and therefore it inhibits the bacterial protein synthesis, and therefore the bacteria is going to die. So this is about in nutshell about the tetracycline. So see here all the tetracycline, they all possesses the four ring in a cycle form. So that is why they call the tetracycline. Now we have to shift on the history and classification. This is first point. So we have to classify this tetracyclines group on the basis of source from where the antibiotic get isolated, and on the basis of the duration of action, how much time the drug is going to act. So first we have to classify the drug based upon the source from which the drug has been isolated. So this tetracycline based upon the source is divided into two types. One is the natural, another is the semi-synthetic. So natural means this and those antibiotics that are naturally isolated from any microbes, they are called natural. And in this natural, we are going to modify some structural modification. As a resultant, we get some new antibiotic, and we are going to call it the semi-synthetic tetracycline. So first we have to go through the natural tetracycline. So under the natural tetracycline, there are mainly three tetracycline that are coming under the natural tetracycline, that are oxytetracycline, chlortetracycline, and demiclocycline. And another way of classification of this tetracycline is based upon the duration of action. So based upon the duration of action, the tetracycline has been divided into three types: short-acting tetracycline, intermediate-acting tetracycline, and long-acting tetracycline. Short-acting tetracycline, there are three antibiotics are coming under the short-acting tetracycline, and that are tetracycline, chlortetracycline, and oxytetracycline. Now the question is arises how we have to recall this short-acting. So you have to only recall the tetracycline. Another For another one, you have to only put the chlorine group and oxy group. So therefore, the name is chlortetracycline and oxytetracycline respectively. So short-acting tetracyclines are tetracycline, chlortetracycline, and oxytetracycline. Now we have to shift on the intermediate acting tetracycline. Intermediate acting tetracycline are two types, and these two are demiclocycline and methacycline. And in these two, you have to see here the methyl is coming. So in demiclocycline, there is removal of one methyl group from the chlortetracycline. Therefore, the name of resultant compound is demiclocycline. So, demiclocycline, the another name of demiclocycline is D-methyl chlortetracycline. That means कि from chlortetracycline, we removed one methyl group, and a result we received another antibiotic. We are calling it the D-methyl chlortetracycline, or in short we are calling it demiclocycline. So in this the methyl group is important, so therefore the another one is methacycline. So this intermediate acting tetracycline are two types, that is demiclocycline and methacycline. And the third and the last the tetracyclines, in which there are mainly two important tetracycline existing, and they are long acting. Why they are long acting? Because they are very high protein bound as well as lipophilic. So because of the lipophilicity of these two, they are exist within the body for longer time interval, and therefore they are kept under the long acting tetracycline. And these long acting tetracycline are mainly the two, the doxycycline and minocycline. And the doxycycline, the another important point with the doxycycline is that doxycycline is also used in nephrotoxic patient, because this is safe to use in the kidney patient. So this is about the classification of tetracycline based upon the duration of action. Now here I am going to mention one very important point, that the chlortetracycline is a natural tetracycline and is called prototype of the tetracycline. That means कि other tetracyclines are derived from this chlortetracycline, or somewhat you can say the they are some have the structural similarity with the other tetracycline. So chlortetracycline, that is a prototype of this group and introduced in 1948. And this tetracycline is also broad spectrum, because this tetracycline is not only acting on gram-positive bacteria, also acting on gram-negative bacteria, also acting on the aerobes, anaerobes, chlamydia, rickettsia, mycoplasma. So that is why this tetracycline is a broad spectrum antibiotic. Now we have to shift on the another point, that is the source and chemistry. Regarding chemistry of this tetracycline is concerned, tetracycline as a group is concerned, this is the congener of, this is called closed congeners of polycyclic naphthacene carboxamide. Why we are calling it the congener? Because they are having the structural similarity with the polycyclic naphthacene carboxamide. So that is why the tetracyclines as a group is a close congener of the polycyclic naphthacene carboxamide. So as earlier I have mentioned, this tetra name is because of the presence of the four ring in cycle. So that is why under the chemistry they possess four ring, and they are amphoteric in nature. Amphoteric means that they are possessing the character of both. Ampho means both, means that this is acidic characteristic as well as the showing the basic characteristics. That is why the tetracyclines as a group is amphoteric in nature. And another very important point is that usually the tetracycline, oxytetracycline, and you may say the other tetracycline are also possessing chelating property. They are going to chelate the divalent and trivalent metal. So this is very interesting property of this tetracycline. They are going to chelate the divalent and trivalent metals. So now we have to classify this tetracycline based upon the source. The one, and that is why they have divided into two types, that is the natural source and the semi-synthetic source. So natural source from which these tetracycline are isolated are only three types, that are oxytetracycline, chlortetracycline, and another one is the demiclocycline. So oxytetracycline has been isolated from the species Streptomyces rhamnosus, whereas the chlortetracycline is isolated has been isolated from the Streptomyces aureofaciens, whereas the demiclocycline, that is also known as dimethyl chlortetracycline, that means ki we are removing one methyl group from the chlortetracycline, and as a resultant we got the antibiotic, we are calling it the demiclocycline. And this one is also obtained from the same source, Streptomyces aureofaciens, but the difference is that this is isolated from the mutant strain of the Streptomyces aureofaciens. So there are three natural tetracyclines, are oxy, chlor, and demiclocycline. So this is all about the natural tetracycline. Now we have to go through the semi-synthetic tetracycline. So semi-synthetic tetracyclines are methacycline, minocycline, and doxycycline. So these three are the semi-synthetic tetracycline. Now we have to shift on the mechanism of action or pharmacodynamic, or you can say how the antibiotic tetracycline is going to restrict the growth of the bacteria or microbial growth inhibition, or you can say the stop the growth of the bacteria. So as earlier I have mentioned, this tetracycline is going to inhibit the protein synthesis of the bacteria by acting on the 30S ribosome of the susceptible bacteria. So how this drug is going to act on this tetracyclines as well as the another group glycyl cycline is acting on the 30S ribosome of the bacteria, and therefore it inhibits the bacterial protein synthesis and restrict the growth of the bacteria. So how the first we have to shift on how this two group tetracycline and glycyl cycline are going to enter inside the bacteria. So first they enter inside the bacteria by the outer layer, the outer membrane by passive diffusion, whereas the inner cytoplasmic membrane through which the drug is going to enter by active transport. That means they are going to require the ATP. So after these two layers, the drug get enter inside the cytoplasm of the bacteria. So once the drug act on the cytoplasm of the bacteria, it goes at the site where the 30S ribosome is existing. So this tetracycline is going to bind with the 30S bacterial ribosome, and the site we are calling it the A site. So this drug is going to act on going to bind with the 30S bacterial ribosome, and therefore it inhibit the access of transfer RNA, or you can say amino acid transfer RNA to reach to acceptor site on messenger RNA ribosomal complex, and therefore because of the inhibition of the transfer RNA to bind with the A site of the messenger RNA, transfer RNA is actually carrying the amino acid, so therefore the transfer RNA carrying the amino acid is not reached at the A site, therefore the protein synthesis get inhibited, and this is explored in this way in the structure form. So this is the ribosome, and as you know, the part of 70S ribosome of the bacteria are two the unit subunit, that is the 30S ribosome and 50S ribosome. On the 30S ribosome, this have the messenger RNA, and messenger RNA have the sequence of the different amino acid, and accordingly the transfer RNA carrying the amino acid, and that are going to bind with the particular site at the messenger RNA. So the site where the mRNA at which the transfer RNA is attaching is called A site. So this site is called A site, and another site which is called P site, where the already amino acid is get attached together, but they are not complete protein synthesis. The protein synthesized. So that is why we are calling it the nascent polypeptide chain. So what will happen? Transfer RNA is carrying the amino acid is going to bind with the 30S ribosome mRNA ribosome complex. So this is the 30S ribosomal 30S mRNA ribosomal complex. So here you see tetracyclines from the cytoplasm get entered inside this site and bind here. So tRNA is not having the site to which to which they bind. So therefore it inhibit the process of protein synthesis, because transferase reaction is not completed. So therefore in nutshell, if you want to define how this drug is going to act, I mean the tetracycline as a whole group, they are going to bind with the 30S ribosomal subunit of the bacteria, susceptible bacteria, and therefore it inhibit the bacterial protein synthesis and restrict the growth of the bacteria, and this is the mechanism of action in short of this group. Now we have to go through the another subheading, that is the antibacterial activity of tetracycline as a group. So tetracycline is a bacteriostatic. As I earlier mentioned, those antibiotic they restrict the protein synthesis of the susceptible bacteria are usually bacteriostatic except aminoglycoside. So this tetracycline is a also protein synthesis inhibitor and therefore bacteriostatic in nature. And this is the primarily, you can say this is the primary mechanism of action of the tetracycline. So next point, this drug is broad spectrum. So broad means ki this one is not only specific for gram positive, but this is also going to kill the gram negative bacteria, also going to kill rickettsia, coxiella, mycoplasma, chlamydia, legionella, and some typical mycobacteria. So this is very, very important and it's interesting. As well as this is going to kill plasmodium, also going to act against the actinomycete. So that is why this tetracycline is a broad spectrum antibiotic groups. Another interesting point in this is that chlortetracycline and oxytetracycline is having the ophthalmic use also. So this is the important. So another two antibiotic, the minocycline and doxycycline, and the both are the long-acting tetracycline because they are lipophilic in nature and they are not only having the possessing the antibacterial activity, this minocycline and doxycycline, in addition to antibacterial activity, also possessing the anti-inflammatory and immunosuppressive property. Oral tetracycline, I mean those tetracycline we are administering through per os or oral administration, they are going to inhibit the bacterial growth or bacterial microflora, and therefore the imbalance of the microflora occur, and therefore they are going to produce the growth of the resistant bacteria like Candida, Enterococci, Proteus, Pseudomonas, and therefore finally going to produce infection. And this infection we are going to call it the supra-infection or super-infection. So this tetracycline, particularly those we are administering orally, they are going to form the supra-infection or super-infection, particularly by the Clostridium difficile growth and Clostridium perfringens growth, and these two species is going to produce a disease in patient that is coming under the supra infection and super infection, that is called pseudomembranous colitis. So pseudomembranous colitis is the disease coming under the super infection and supra infection produced by the growth of Clostridium difficile and Clostridium difficile. Interesting point with the tetracycline is also that is also acting against the staphylococcus, particularly that is the resistant. Which type of resistant? Methicillin resistance staph aureus. So this tetracycline is also acting against the methicillin resistant staph aureus. So now we have to go through how the bacteria is developing the resistance against the drug or tetracycline, or you can say the antibacterial agent. So as earlier I have mentioned in chloramphenicol that usually they are resistant, bacteria is going to develop the resistant, and that are usually, or you can say primarily plasmid mediated. Here with the tetracycline, the resistant developed by the bacteria is plasmid mediated, as well as also developed by the mutation. So there are three ways by which the bacteria is going to develop resistance against the tetracycline. How? The first, the bacteria is going to inhibit anyway the accumulation of the drug in the cytoplasm. So if the drug is not sufficient accumulated in the cytoplasm, so that is not available to act on the ribosome and inhibit the protein synthesis. So the resistance bacteria is going to inhibit the accumulation of tetracycline. How they are going to inhibit the accumulation inside the bacteria? Either they are going to inhibit the influx of the drug, so it inhibits the permeability of the drug, or either if the drug is rich even in the cytoplasm, that should be evacuated by efflux mechanism. So by these two mechanisms, the drug tetracyclines are not going to be accumulated inside the bacterial cytoplasm, and therefore these are resistant against the tetracycline. Another mechanism is that the target of this bacteria is the ribosome, 30S ribosome. So what this resistant bacteria are going to do, they are going to cover the susceptible protein synthesizing ribosome. So what they are going to do, they are going to synthesize the protein, and that protein is going to cover the susceptible ribosome. So therefore, if the susceptible ribosome is going to be covered by the protein, the drug should not be reached at the target, and therefore the bacteria is not going to be inhibited. So the resistant bacteria is going to synthesize the ribosomal protection protein. It covers the ribosome, so therefore the drug should not be reached up to the target. So this is the another mechanism of the bacteria is going to develop the resistance. The third and the last mechanism is the resistant bacteria is going to synthesize the enzyme, and these enzyme is going to disrupt the structure of the tetracycline. So when there is disruption or breakdown of the antibiotics occur, this is going to inactivate the tetracycline. So resistant bacteria is going to produce the enzyme, and by which means production of enzyme, they are going to act on the tetracycline and break the structure of the enzyme, and therefore for the tetracycline get inactive, and by these three means the resistant bacteria is going to develop the resistance against the tetracycline. Now we have to go through the another heading, that is the pharmacokinetic. So as earlier I have mentioned, it include absorption, distribution, metabolism, and excretion of the drug. So first we have to move on the absorption. So when we are going to administer the drug by oral route, the absorption is usually incomplete, particularly in ruminant, and also get impaired if there is presence of any divalent or trivalent or antacid within the GI tract. So if the GI tract have divalent ion or trivalent ion or antacid or milk or dairy product in the GI tract, they are going to bind with the tetracycline, and after the binding of the with the tetracycline, they are going to be tetracycline are going to be come out through the feces. So that is why the chelation of the both metal as well as the tetracycline occur. So therefore, when we are administering the drug through oral route, we have to administer the drug after 2 hours of the meal or before 2 hours of the meal, so that nothing should be there, either divalent or either trivalent or either antacid or any dairy product in the GI tract. So that should not be chelated. So next is the distribution of this tetracycline is concerned. Distribution of the tetracycline is concerned. This drug is widely distributed throughout the body. So this is the very important property of the tetracycline, that the drug is widely distributed not only in tissue, also in the body, different body fluid, also in the different secretions, and it also get accumulated in the reticuloendothelial system of liver, spleen, bone marrow, bone, dentine, and enamel. And because of this accumulation in the bone, in the dentine, and the enamel, they are going to form their chelate complex. That is the chelation complex, and we are going to call it tetracycline calcium orthophosphate. and that are going to be deposited there, and they are going to form the brown discoloration of dentine, bone, or enamel. And this is usually seen in developing bone or developing teeth. So not only this widely distributed, this is also across the placenta. So drug is easily reached in the fetus. So usually we are going to avoid the tetracycline to administered in case of the pregnancy. Now we are going through the excretion, how the drug tetracycline is going to be excreted out through the body. So drug is going to primarily excreted out from the body by the kidney by glomerular filtration. And some of the drug is also going to be, some part is excreted out through the bile. So bile excretion is also there, and because of that, those drug or those tetracycline is going to be excreted out through the bile, possessing an important property, that is the enterohepatic circulation. So they are possessing the enterohepatic circulation also. Next is the, amongst these all the tetracycline, doxycycline is the particularly safe in kidney patient, because the doxycycline some part is going to be excreted out through the bile, so they are somewhat more safer to be used in the kidney patient. So doxycycline is the safer to use in the kidney patient. Demiclocycline. Demiclocycline is usually not to be used for therapeutic usage. Why? Because of the two very important property. One is because of the high risk of photosensitization. What it means, after the taking of demiclocycline, if the patient will go outside in the sun, this is going to produce the photosensitization. Not only that, this demiclocycline is going to produce the kidney toxicity, and this is going to produce a condition we are going to call it nephrogenic diabetes insipidus. So demiclocycline is going to form not only the photosensitization, also going to produce nephrogenic diabetes insipidus because of the reduction in the antidiuretic hormone. And therefore demiclocycline among the all tetracycline is to be used very rarely because of these two properties. So this is very interesting and important. Now we have to go through the therapeutic use of the tetracycline. So as I earlier said, this is the broad spectrum of antibiotic. So this is very much usable group of the drug. Not only that, this is the first line of antibiotic for ruminants and swine, because this that usually the cost of this group is low, as well as the limited, as well as the we have very less antibiotic group, they possessing the broad spectrum property. So because of this low cost of this group, as well as the limited availability of antibiotic, that is broad spectrum, this is the first line of antibiotic for the ruminants and the swine. Now, not only this is used for the infection, as well as this tetracycline is used as a growth promoter. So for as a feed additive, some of the tetracycline we are using as a growth promoter in a feed. So this is used as a feed additive. Next is the next important point is the doxycycline, about the doxycycline. As I earlier mentioned, this is the safe for the use in the kidney patient. This is usually used for the therapy of respiratory tract infection. And this is broad spectrum, as I earlier mentioned. This is used for rickettsia, mycoplasma, chlamydia, anthrax, brucella, cholera, actinomycosis. So this is very important group of the drug. So this is all about the therapeutic use. So next and almost the last point is the untoward effect. So untoward effect is the very interesting property, because this will restrict the use of the drug. I mean, if the drug is possessing high untoward effect, that we are not going to use. As we have seen in the case of demiclocycline, we are usually not using demiclocycline as a therapeutic use from this group because of the two toxic properties, that is the photosensitization, and another is the nephrogenic diabetes insipidus. So first, when we are administering the drug in through the oral administration, the drug should reach in the GI tract. So in the GI tract, they are going to produce the GI irritation. So most of the tetracycline are going to produce the GI irritation. So as well as, because this is the broadest spectrum, they are going to kill most of the microflora. And because of the killing of microflora of the GI tract, they are going to produce the super infection or supra infection that we all already discussed earlier. And they are going to form a disease. We are going to call it the pseudomembranous colitis, and also known as A. colitis X. What is this? This is only because of the overgrowth of the organism like Clostridium difficile and Clostridium perfringens. So this is when the drug is comes in the GI tract. So GI irritation, and after the absorption, the drug reach in the liver. Drug also reach some part get reached in the liver. So in the liver, some of the tetracycline are going to produce the toxicity or toxic to liver. And there amongst the all tetracycline, the oxytetracycline and tetracycline, they both are, as earlier mentioned, are the short acting. They are very less hepatotoxic, and that is the reason oxytetracycline and tetracycline are the two drugs that are very much usable in case of animal, particularly the oxytetracycline. And as I earlier mentioned, this group is also going to produce the photosensitization. So this is one another side effect that is going to produce the photosensitization, liver toxicity, as well as this is going to produce the renal toxicity. Renal toxicity, as I earlier mentioned, this demiclocycline is going to produce the nephrogenic diabetes insipidus, and this nephrogenic diabetes insipidus is because of the reduced antidiuretic hormone. And here the few more important points that we have to consider while administration of tetracycline. What these important point? That important point is that usually we are not going to use tetracycline when it get expired, or because the expired tetracyclines are going to produce a syndrome we are going to call Fanconi syndrome, and in the symptom we will receive nausea, vomition, polyuria, proteinuria, and therefore here you have to be cautious before going to use tetracycline. You have to see the date of expiry of the drug, because this is going to produce the toxicity. So therefore, not only that, in somewhere in the field condition, you will find some doctors they are using two antibiotics together. So for that, you have to be aware about that. The tetracycline should not be used along with the penicillin in a mixture. So tetracycline and penicillin should not be mixed together, because the mixture is going to produce the precipitation as well as the inactivation of the antibiotic. So in mixing of this is prohibited. Another important point with the tetracycline is that usually you have seen that tetracycline is going to chelate the divalent or trivalent ions. So this divalent or trivalent ion, as you know, the blood is having very high concentration of the calcium, and this calcium is very much required for the animal. So and for the body use. So when you are administering the tetracycline as IV bolus very fastly, so what will happen? This tetracycline is going to chelate the calcium very fastly, and therefore the availability of calcium, free calcium, get reduced. And as you know, the heart is very much required the calcium. So once the calcium level get reduced in blood, this is going to produce the problem for the animal. So that is why tetracycline, when you are administering through intravenous administration, be cautious to administer fastly. So you have to administer it slowly, because this is going to chelate the calcium, and therefore this is going to produce the problem with the heart or the availability of calcium for the body. And as earlier I had mentioned, this is going to form the chelation product with the calcium, and the name of that chelation product is tetracycline calcium orthophosphate. Tetracycline calcium orthophosphate. So this is the tetracycline. So this is chelating not only tetracycline but also calcium, and this is also going to deposited in bone and teeth and enamel where the calcium is to be deposited. So when this product get deposited there, I mean in bone and teeth and enamel, the discoloration of these places occur, I mean teeth and bone, and this discoloration means that this become brown color. So be cautious to use in neonates and in pregnant animals. So this is uh, all about tetracycline.